Jeremy Gundlach is a communication specialist with the Wisconsin Board for People with Developmental Disabilities, or the WBPDD. And he supports the board members before, during, and after all board events. And then he is passionate about natural supports and how they can assist both individuals with disabilities and their families. And he participates in SIB shops and is now a trained facilitator. He's also the lead facilitator for the YIPPY program, and he trains and supports families and their transition age youth with disabilities. And I've had the fortunate pleasure to be out in the community with him while he's been promoting the self-directed healthcare toolkit, and I really feel it's a great tool that's been used by many people and has offered a lot of valuable information and insight to the healthcare process. So do you want to go ahead and get started, Jeremy?
Yeah, for sure. So thank you once again for inviting me to be on today. And so this is this healthcare toolkit is something that was put together for an old project back in the early 90s, I want to say, for BPDD. And we had a grant for we called it Mind and Memory Matters, but it was about doing outreach on the impact of dementia and specifically Alzheimer's to the IDD community. And so we felt for that and for a lot of reasons, it was a good time to update this healthcare toolkit and just make sure that we're really promoting it. And so if you want to go to the next slide, Maya, please. So I just, it's going to be hard to read, but I do have links to the electronic files for all these at the end of this, but I just wanted to give you guys kind of a overview of what it looks like. So it comes in a folder, and this is kind of what you open up to. Marcia Stickle, who was a nurse consultant on our Mind and Memory Matters grant, helped us put this together because she's definitely the expert as far as healthcare. And so she has this beautiful foreword that she wrote, kind of talking about her job as a Wisconsin inclusion nurse and how she sees that healthcare transition and overall just being independent with your healthcare is, you know, it's a good thing, and it helps in so many other ways of life. And then on the back of this self-directed healthcare sheet on the left, I don't have a picture of it, but you can see that all of these sheets we designed so that you print them out on different colors, and then say for the blue one, that's just for today's visit. And so this sheet on the right would be printed in blue, and it's just an easy way, especially if someone has limited cognitive function or issues with communication, it's just an easy way to visually say, oh, I'm going to a visit today, so I'll grab the blue sheets or the yellow sheet, and then we have a kind of pinkish red sheet for urgent care. And so really today's visit, it's just what do you need to bring to your appointment, a little bit about yourself, and you know, what is the whole point of today? Just because for a lot of youth, especially if, you know, they've grown up and their parents have done a lot of the talking for them in medical appointments, they can be a lot of times a little nervous about talking and saying, well, hey, this is what's bothering me. And so it gives them a chance to beforehand write down some of those things so that it, you know, really maximizes that time with their doctor. Maya, can you go to the next slide? Thank you. So then you go through and helpful tips. These are just, it's a great sheet on just, hey, if you know that you have some complex medical issues or you have some problems with communication or you have sensory issues, anything like that, just some tips on, hey, did you know you can request a longer doctor's appointment, but you just, you know, have to make that request, those types of things. And so we really wanted to have a way where youth can feel like they're very prepared for the appointment. On the back of this helpful tip sheet is some suggested questions just on, you know, so if you're getting new medication, it's a good idea for you to ask, hey, what is this for? When should I take it? What is my dosage? Just to have that conversation. And so you're not relying on somebody else, because the overall goal of this is to have people be as independent as possible. So then this next one, the summary of the visit. Oh, it's fine. It's just a good way to get in the habit of writing down what happened at this visit, because so many times everyone just wants to be out of an appointment. They get out and it's just kind of, you know, a day or two goes by and it's like, oh, what was I supposed to do? And, you know, if you don't have someone supporting you 100%, then that, you know, especially with new medication, things like that, it can be not only bad for your health, but, you know, dangerous. And so, if you want to go forward on the slides. Thank you. And then we have just some stuff, once again, if you have problems with communication, or if you have a complicated medical history and it's a little hard for you to describe all the things that have happened. I know my oldest brother has cerebral palsy, and growing up he had surgery after surgery after surgery and all these therapies and things. And so I'm assuming that he remembers all these things, but he doesn't remember some of the specific medical terms for some of the surgeries and some of the medications. And so this health history, it's just a good way to keep track of some of that, so that if you know, you need a little extra time to communicate, it just helps that conversation go a little bit better. And then the about me, we really like this because it just shows, you know, really at the base level of going into an appointment for your health, you have to, you know, be able to say, hey, this is who I am. I'm, you know, I like to be referred to as this. This is, you know, my name is Michael, but I like to be called Mike, just because, you know, for some people that's a trigger if you don't call them by how they want to be referred as. It can lead to some behavioral issues, things like that. It also has some room to have like your insurance information on there, and then also your support group. So you can say, hey, you know, I want to be as in charge of this as possible, but I have a personal care attendant, my neighbor is real helpful, or you know, my family members are very involved. And so you can list those names so that you can have, once again, just that full conversation with your doctor. And then just some other things, you know, what at the bottom, what do I know, what I want you to know about my disability and how it affects me. We really like that because, you know, being independent about your healthcare, finances, anything, it really starts with knowing who you are and admitting, you know, I need support here or I need support there. And then if you want to go to the next slide. Thank you very much. So then on the left here is the setting up your healthcare appointment. This is one of the things that was not in the old healthcare toolkit, and we felt it was very necessary to put in, just to take out some of the nerves or anxiety of, you know, calling to make your own healthcare appointment, whether it be, you know, with your primary physician, or even if you're just going for a dental cleaning, something like that. And so it's just a real basic script on, hello, my name is, I would like to schedule an appointment with so-and-so. And sometimes it's just easier to write that stuff out. And it makes it so much easier just to get in the habit of knowing, hey, I need to know X, Y, and Z before I call in, because otherwise, you know, there's going to be issues on the phone, or it could take a while, or I could get the wrong date, something like that. And then the urgent care hospital visit, this is a real important one. It's something that you can, you know, keep on you, keep around with important files. So if anything ever happens, and say you have a new support person where you're living, they know that this is something that you can take in, and it has just a quick overview of things that anyone who's being admitted into urgent care, or the people rather who are helping, should know. You know, I'm here because, you know, I've been sick for days, things like that. And once again, this is all, you know, to help people to communicate as accurately as possible and independently as possible. And so, once again, this is all paper. I do have the, in a couple slides here, I have where you can download those from our website. But we do understand that in the age of technology, for a lot of people, easier to use their MyChart or just use their phone to check on things. And we totally understand that, but you know, if you can have youth starting to do this at a young age, hopefully by the time they are adults, they will have whatever works easiest for them, but they'll know at least the basics of, you know, I need to know my medical history. I feel confident that I can set up an appointment, and you know, here's an understanding of whatever doctor's appointment I went to today or yesterday, those types of things. And then the last item in the healthcare toolkit, if you want to go to the next slide, much appreciated. It's the NTG-EDSD. This was something that we took from our Mind and Memory Matters project. It's an early detection screen for dementia, and it works as a baseline. You find a baseline of cognitive functioning, and then you continue to fill this out until you start to see you know, some changes, and then at that point you would go in for a memory test or you know, something a little more accurate than this, because this is just a screening tool. It's not going to give you a diagnosis one way or another. And so the reason we wanted to put this in here, even though we're really promoting giving this out to youth, is that finding a baseline is important at an early age and at the highest point of cognitive functioning. And so if you read this, it says that they would prefer that you get that baseline at the age of 40, I believe. And you know, we thought, hey, why not get it a little earlier and have that first baseline done at, you know, 16 or 18, and then do it every 5 years, do it until you start noticing changes, things like that. And so we felt this was a good way to tie in that grant and overall focus on healthcare. And this can be used for a lot of things. So it's a somewhat lengthy document. But it's very thorough. It goes through activities of daily living. It goes through, you know, traumatic events for someone who's aging with a disability, losing their parents possibly, or you know, we hear a lot about people who have personal care attendants that move on to new jobs, and that's, you know, can be very traumatic for people. And so it keeps track of, yes, their cognitive functioning baseline, but it also keeps track of, you know, where's their mental health at? Are there reasons for, you know, some like depression or things like that? And so it's just a good overall tool. And so if you want to go to the next slide, Maya. Thank you. And so this is the link up top is where you can find all of these, and we have them in Spanish also. And then below, that's just a picture of what it looks like on that publications page on the board's website. And so once again, you can, you know, fill these out on the computer or print them out, whatever works best for the individual. And then so just as a little bit of a transition, and I have quite a few slides, but we don't need to go through all of them for this. But with the supported decision-making being a legal option now in Wisconsin, we were thankful enough to be one of the first states in the nation to have a supported decision-making law. And so we feel this is definitely a big part of, you know, transition, specifically healthcare transition. A lot of families are, you know, given very limited information on, you know, guardianship and what happens when you become an adult. And so the idea behind supported decision-making, oh, thank you. And then if you can even go to the next slide. So the idea for support decision-making is it's a way for people with disabilities to use friends, family members, and professionals to help them understand situations and choices they face so they can make their own decisions. That being said, this isn't, you know, this is like a least restrictive option, whereas guardianship may be the most restrictive option. And so not to say that we think guardianship is bad, but we don't think that it should be the first option for youth with disabilities. And so if you want to go to the next slide. Thank you. So 3 principles of support decision-making. Everyone has the right to make choices. People can get help making choices without giving up that right. And people often need help in understanding, making, and communicating their choices. When we talk about this with you know, Yippee families or at other events. I always use the example of, you know, I have a car, but that doesn't mean I know anything about cars. And so, but I have a very good friend, and that's one of the things that he does. And so I go to him for those types of things. My dad owns a small business. And so when I have issues with finances or taxes, I definitely hit him up first. And so that's kind of how support decision-making works. You're not giving away your right to make decisions. It's more about setting up supports, and it's on paper that they're supports, and they're not making the decisions for you. They're just helping you to, you know, understand what that choice is that you're making. So then if you could go to the next slide. Awesome. And this is kind of just what I was talking about with my car and finances, is all of us use supported decision-making in one way or another. Nobody's an expert on absolutely everything in life. And so it's just easier to have those supports, but this is a way, rather than giving up that your rights to make those decisions, it's just setting up ways to, you know, make sure you're supported. The other thing is, this is not something that is like, if you're under guardianship, that you can't use supported decision making. You can still use this and have these agreements set up. At the end of the day, that choice, hopefully whoever your guardian is will still work with you to make those choices. But at the end of the day, if they're your guardian, that legally they're the end all decider. But it doesn't mean that people under guardianship still can't help make those decisions, especially, you know, because it's their life. And then if you want to go to the next slide. So why is this an option, and why was this something that people have worked for years to get passed in Wisconsin? Studies show people with disabilities who exercise more control over their lives are healthier, more independent, better employed, and better able to avoid and resist abuse. Those are all things that, disability or not, I think everyone can say that they would aspire to be healthier, be more independent, be better employed, and be able to resist abuse. And so, you know, at BPDD, that's one of our goals overall, is that we want to see people living, working, and doing what they want in their community. And so this just makes so much sense. And especially coming back to healthcare transition, if somebody has never made these decisions and they've never been the one discussing those with their doctor, it makes it a lot harder to make those decisions and be informed about those decisions as you get older. And, you know, being that, you know, your personal care attendants might change, your support group might change, all that is very important for people with developmental disabilities to have this information somewhere that they can be independent about it, at least as much as possible. And then next slide. All right, and so this one, it's got a lot of text on it. I won't go through all this, but this is just a quick overview of some of the tools that people can use in Wisconsin to make decisions. We have, and then at the bottom, I don't know if you can quite see it, but there's an arrow showing less limiting and more limiting. So obviously on the right, for more limiting is limited or full guardianship. And then as we go left, we have powers of attorney, medical proxy, representative payee, and then supported decision-making. And then at the least limiting end is just release forms. And so this is just a great graph to, if someone is new to all these terms, to just say, hey, here are some of the options. And then it goes through a little bit about what each of those is. So then we can go to the next slide. And this is what I was talking about earlier, is you can still use the formal supported decision-making agreements while you have a power of attorney for finance or medical, or even if you have full guardianship. Like I was saying, that doesn't mean that somebody is just no longer going to make any of their decisions. And obviously this is different based on the individual. There are some people, depending on functioning or communication, where this might not be the best option, but we believe for many youth that it's just a good way to stay in control of your life. Next slide. Thank you. And then so this I wanted to put in here just so that you have a little bit of an overview. Being that this is a new law, we've been really trying to get out around the state and have presentations at different conferences, different meetings, just so that people are getting knowledge about what support decision making is and you know, what does that mean legally. And so just talks a little bit about, you know, who will help be a supporter and what does that mean. And so really you're just a middleman or woman and a conduit for taking some high level decision making and bringing it down so that somebody can understand it and then helping them make the best decision for them. And then can we go to the next slide? So this is specifically who is eligible to have a support decision-making agreement. You can see on the bottom is a list: people of any age with degenerative diseases, people of any age with conditions that substantially interfere with ability to provide care, people with physical disabilities, people with intellectual and developmental disabilities, people with mental health conditions. And so this Wisconsin support decision-making law is much more inclusive of age groups and levels of functioning than a lot of other states. I know that the people who worked on this really wanted to make sure that people with mental health conditions would be eligible for this, and people who are aging and maybe have something that causes dementia would be able to use this so that they can hold on to that independence for as long as possible. And next slide. Thank you. So a little bit on what they don't do, because we all like to figure or spend time on you know what this will do. This does not restrict someone's right to make any decisions. Their supporters are not actually legally making those decisions. They are only there to help. It's not giving supporters any sort of, you know, legal stance for signing documents or to make sure that they're, you know, pushing someone into anything else to sign or anything like that. It's not giving supporters any new rights. It's just saying, hey, this is someone that I've identified that will help me. And then we go to the next slide. All right, and so this is where you can find all the info on the supported decision-making law. The first link will take you to the actual supported decision-making agreements on the Department of Health and Human Services website. These are, it's great the way that it's laid out. You get this form and it has an intro and it goes over a lot of what I just went through. And then it's got the actual decision-making forms. I guess I should have put a couple of pictures of what that looks like, but they're very basic forms. They're not flashy. There isn't a bunch of little boxes to check or anything like that. It's very well done. That second link goes to the actual Wisconsin state statute. So, you know, if anyone has questions about whether this being a law or not, it definitely is. And then the last two are some of our specific resources. So we've had this support decision-making project out of BPDD for the last couple of years. And so we have this wonderful Supporting Individuals to Live Full Lives Guardianship Alternatives booklet. Some of you may have seen it. I know that we've been getting it out to a lot of ADRCs, a lot of managed care organizations, a lot of families at Special Olympics, just really trying to push it out so that families have more knowledge on this. And so that's what that Live Full Lives guide is. And then we have a web page that is just dedicated to support decision making and some of the other guardianship alternatives. And so this little half booklet is a wonderful resource. It gives an overview of, you know, guardianship, support decision-making, repayees, power of attorneys, those types of things. And then we have a lot of like 1 or 2 page fact sheets. I want to say one is 4 or 5 pages. It goes very in depth. But if you want more information, that's a great place to go into those specific topics. Also, we have lots of links to other presentations, other websites of people who have worked on the support decision-making bill and our project. So these are great resources for that. And it's one of those things, once again, you know, bringing it back to healthcare transition is, you know, we really want to see this get into the hands of families and youth at a much younger age, so that parents aren't all of a sudden, you know, at 17 and a half, you know, at the end of school or say 20 and a half saying, oh, what's happening with some of this healthcare, and especially at 17 and a half looking at guardianship. So we want to make sure parents are informed. So I think that might be it for slides.
Yeah, that was the last slide that I've got here. But I do want to just pause for a second. Thank you very much. That was a great review of the healthcare kit and some of the additional resources and supports that you offer. I want to open it up to the group. Are there any questions regarding some of the topics that Jeremy went over? I know some of you are working on supported decision making, and especially inside of a healthcare setting. So now would be the time to ask an expert who's on the phone with us. You can also use the chat box. While people are doing that, is there a way, if they would be interested in having someone from your team come and speak to them, or would you refer them to somebody in the community that does that type of supported decision-making presentations?
Yeah, definitely. So we are working on getting a number of people around the state trained to do the same presentation, essentially, so that we know that there's consistency. But out of our office, Tammy Jackson is definitely the expert on this. She did a lot of work on our support decision-making project, but also on the bill meeting and getting it passed. And so she's definitely one of the experts who's been going around. And so we could definitely set that up. The only thing is she's on maternity leave for a little bit. She had her second baby over the summer, late into fall. And so that would be the only thing. But like I said, there are several other people that have been doing these trainings. And so if anyone wants to reach out, I'd be happy to help set something up. I did type my email into the chat box, so if anyone has any questions, feel free to reach out.
Great. Yep. And I will plan to also have all of that information available when we have the presentation up on our website with his contact information, as well as links to all of the things that were discussed today. We have 3 minutes remaining, so if anyone has any questions regarding the clinical report or anything that Jeremy went over. No? All right. Well, I give you the gift of 2 minutes. And otherwise, thank you for joining us. And this completes this month's and this last year's learning community. Thank you all for joining.